of VLGA Connect today. I'm very pleased to welcome to the program Diana Egerton-Warburton, a professor at Monash University and a practicing emergency physician. Diana, perhaps, firstly, welcome to the program, and perhaps you can just give us a brief idea of how you divide your time up between those roles these days.
Great. Well, I'm a full-time clinician, but I'm engaged in research and research around not only clinical research, but a lot of public health research. And I work with a lot of local governments, particularly in the southeast, around a lot of our alcohol harm projects. But today I'm talking about social distancing, because some people might think it's a little bit odd that an emergency physician would be interested in it, but the more physical distancing we do and the more effective it is, the less people we're going to see in the ED.
Well, I believe that. I've just today been hearing some research that's come out of Columbia University in America, where they've said just 1 week earlier introducing physical distancing would have resulted in 36,000 less deaths. So what you're saying is crucially important at the time that we're in with COVID-19. So I'm really interested to know, what is the work you're doing around developing resources to assist with response to COVID-19?
So I've worked with the, and particularly the Health Design Collab, and we've done a lot of projects in the past around using human factors. So people may or may not be familiar with human factors, but it's a concept which is used in high-risk industry, including the nuclear industry and including in the army and other high-risk areas. And what it involves, it involves using design, thinking about the people, their equipment and their environment. And it's a more effective way to make sustainable change and also improve safety. I think you can see behind me one of the posters that we've designed. And what we noticed earlier on is a lot of even the major retailers, their signage around physical distancing or social distancing was highly ineffective. Some of it you had to get so close to see it that you couldn't possibly stay away from the people that were behind the counter. Now, a lot of the large businesses have really done an amazing job and got fantastic signage and resources available, including screening and things. What we noticed was a lot of small business didn't have access to those things. So we created very carefully designed images, and we made them freely available and distributed them, and we're really keen to distribute them through networks such as yours for local businesses to use.
So that's an example behind you there of a poster that would be put up in a shop, for example, or a workplace. Is that the aim?
Yeah, we've got a series of ones and they're all available on our website. They're free resources designed by health designers and researchers. We've got them for queuing, for purchasing and for working.
Right.
So we've got different examples. We've worked very much in this in a logo-free zone. So we're not putting any Monash Uni logos on them or anything. And if people want us, and if they approached us wanting to put their own logo on, then we'd be very happy to add logos to it so they can add them. But we've found particularly small businesses, retailers, market stalls, that sort of thing, have really embraced the resources.
So Diana, it occurs to me, while this is social distancing obviously has been a very important concept for people to come to grasp with and understand through this whole process, as restrictions start to be eased, this is going to become even more vitally important, isn't it?
Absolutely. You can see how in Victoria, with the blitz on testing, there are, I think, 24 cases that were discovered that had no connection. So they were community-acquired cases. And you can see at some of the cluster examples where one case can become 100 within a couple of weeks.
Yes.
So the physical distancing at home, on the street, while queuing, while shopping is absolutely vital. And it's really important for us to realise that the virus is still there, and we can only contain it by very careful physical distancing.
So where does local government fit into this? How are you working with local government, or how can councils assist in your...
Yeah, over the years, as I say, I've had a great relationship with local government, and they're such a pivotal and important part of the whole community network. And I think that the work that they've done around the signage within their parks, within their playgrounds, and within their own offices has been excellent. But what we want to do is for your networks to distribute our resources. And I think that we were also hoping that we could send it out potentially, especially to small traders. So any event that's happening as we start opening up restrictions, if we could supply them with the posters, so that then if they're having an event, they have the resources available to them to be that physical prompt to remind people about physical distancing.
So you mentioned that the materials are available via a website. Can you tell us what that site is and where people can find out more?
Yeah, so it's COVID-19 as one. So that's all in, COVID-19 is in numbers, and then as one is in letters.
.com.
Yeah.
Yeah, COVID-19as1.com. Before we go, question without notice. This is something that's been a topic of conversation in my household around social distancing and some of the clusters that we're seeing. We've seen a meat workers plant in Melbourne, for example, but right across the world, it seems those meat packing plants are producing clusters. Why do you think that is? Have you looked at the various factors that those sorts of industries seem to develop bigger clusters of the virus?
I think the situation is the virus cannot move by itself. Right. It requires people or things to move it. Okay. Any production line where you've got things moving allows the virus to be on it and to move. So any area where you've got a lot of movement is where the virus is going to spread. So I think it's really, really important to remember that the virus cannot move by itself. It requires us to move it. And that's where physical distancing will be what will allow us to open up, get those people back to work, get the community having a balance. But we've got to maintain the social distancing.
That's a really clear and simple way of looking at it. Thank you very much for that. Diane, it's been great to meet you, and I can tell it's a very busy spot where you are working today, so I really do appreciate you giving us some of your time to tell us about this project. All the very best.
Great, thank you.